All right, and we're live, and hopefully you can hear us, see us, and hopefully with the chat down below, you can actually interact with us. A lot of you have already done that ahead of time, which is great. We got almost 50 questions just over the past couple of days, so this is turning out to be a great success before we even started. But before we get into today's episode and our first episode, I think it's important that we touch on exactly why we're here and what we're doing. So without further ado, I do want to introduce our guest today, senior partner, Dr. Hartman. Hello, Dr. Hartman. How you doing today?
Good. How about yourself?
Oh, not too bad. So what exactly are we doing here? What was your genius plan to get this whole WMPEDS-Live thing off the ground and running?
Well, let me preface by saying I'm not a high-tech person, but I like to use high-tech. So I depend on a lot of other people. And I have an IEP and a 504 also plan, so because I need a lot of help. But the key, I think, is one of the themes of Westwood Mansfield Pediatrics that runs through its mission is proactive in your child's care. And this is a way that we can reach out to our patients with timely information, and especially in this COVID crisis. And we also want to use multimodal communications. So we hope that you will join Facebook, Instagram, Twitter, and also you're on our email list as well. And so that you have optimal ways, we call this multimodal communication, to get the information you need that is coming from a strong evidence-based source, given how much is given out every single day. And please continue to read the emails. We have 3,000 emails on that, but we could probably get another 1,000 or 2,000 more people to sign up as well. And a lot of communications will be there that would avoid phone calls to the office necessarily. So the goal for today is to educate and inform our families about things with COVID, the COVID crisis, regulations, daycare, and etc. So without further ado, take it away, Joe.
Yeah, awesome. And in the future, hopefully once this whole COVID thing is behind us, we can certainly open this up to really anything that the audience wants, and any other current events or anything else in the pediatric world we can certainly touch on, and continue to do these WMPEDS-Live events to just show, what we're dealing with, and anything interesting that we think everyone should know about. But with that said, today, obviously, what's on everyone's mind is, the current events related to COVID. And I think we chose 3 topics today, which I think are very important to touch on. And we're actually got so many questions on them that we're glad that we picked them, because everyone's asking about it anyway. So the 3 things that we're going to touch on mainly in the first segment is antibody testing, symptoms that we're seeing in pediatrics, and also treatment. Later on, when we get into the question and answer portion, we're going to touch on daycare, play dates, grandparents, newborns, all those social distancing type things. Now that things are starting to loosen, what our thoughts are on how to do those things most appropriately. But again, before we get to that, let's go straight into antibody testing, Dr. Hartman. I'd actually like to start with a question that we did get from the audience. We had a question from Jay. He is a parent in the practice. He wants to know why we're not offering antibody testing at WMPEDS.
Well, let me start. I've been involved with development of a platform for the home strep test, and the company that I worked with wanted to do a home COVID test. So I've studied this fairly well.
Mm-hmm. Mm-hmm.
These tests, all they say is you're positive or negative. So henceforth with this, this test we aren't going to use until we have a much better test. And we're very concerned that people are going to start to think, well, I'm immune. No, you're not immune. You're not protective immunity. You may have some immunity, but that doesn't mean it's protected. And you have to social distance. You have to wear a mask. You can't go around people that are sick with this. So it's very important for people to realize this test is not as reliable yet, and it's not approved. It's authorized because of the emergency situation. And again, there are a lot of false positives and false negatives with these tests.
Yeah. I think we lost audio for a second there, Dr. Hartman. I tried to do something fancy, which probably shouldn't have done. I tried to isolate just your face and take out mine. So I think we lost audio when I did that. I apologize, but we have a very keen audience that picked up on it right away, and I think we fixed it. So I think the gist of what you touched on when we couldn't hear you was just about the reliability of the testing. And it's not really a decision-making tool right now when the reliability is so low.
Not on an individual level.
And I think in comparison to the other tests that's out there, which is, not the antibody test, do you want to touch on a little bit about maybe the difference in terms of what it means for treatment if you do the other type of test, which is, straight in the nose?
The other test is a nasal swab. They're actually going to be sputum coming out where you can spit on it. These tests are much more reliable because they're not something that they're actually a part of the actual virus. When you make antibodies, you're making antibodies against parts of viruses in the bloodstream. But in this case, you have parts of the actual virus in somebody's nose, and you do what's called polymerase chain reaction to find with the genetic material, and molecular nucleic acid assays, they're called. And those are the ones that will tell you pretty reliably. Again, they were on emergency use authorization, but they're much more accurate than are the serum antibody, blood antibody tests. And they can tell you when there's an acute problem. The blood antibody test is not going to tell you when you have an acute problem. It's going to tell you, at best, it may tell you if you've had it or not in the past.
Right.
So,
and I think the thing to focus on is if you had an antibody test, certainly doesn't make you invincible to anything. There's really nothing out there that tells you exactly how long it might last, and even if it's certain that you did have it. And I think a lot of people want to have this test done so they can do things that maybe they wouldn't do if they didn't have the test.
I don't
go see more family, and we don't want that reassurance from a test that we don't trust.
The only thing you're going to know whether you're protectively immune is when we have numbers, not positive or negative, when we have numbers that say that you're immune, so that people, when they get vaccinated, they have to reach that level where they have protective immunity. So right now, we just don't know. The irony of all this, though, we expected to see the immunoglobulins that are the antibodies, we expected them to be higher in young, but in fact, the older people produce much more antibodies, even though they're susceptible, than the younger people. So we may not be fully measuring what protects the younger people that doesn't protect the older people.
Right. And I think that's a good segue into, something else that we definitely want to talk about, which is what symptoms are we seeing in the younger people? We hear so much out there that younger people aren't being affected as much, but they certainly still are, being positive and having symptoms. So what are we tending to see right now in the pediatric population?
Well, I think there are things like, they're also very vague symptoms, and that's the hardest part. Somebody who has a cold. I think if somebody has flu-like symptoms right now, body ache, headaches, and fever, you have to be suspicious about COVID regardless of the age. Kids will have sometimes abdominal pain and a little diarrhea with this, as well as fever. So those are signs too. So I think those are important signs to look at too. Now, there are a couple other things. People get what kind of looks like gross looking toes. Those are the COVID toes. that look like they have blisters all over them.
Mm-hmm.
And it looks pretty scary to parents. But the good news is COVID toes means whoever gets it is very unlikely to get COVID severe, like their lungs or what I'm going to talk about next that happens in kids. The other thing is, too, when people lose their sense of smell, and some kids have lost their sense of smell, it is only temporary. It could be days to weeks. And it's also a sign that the disease is probably not going to be serious. Ironically, this is a big complaint in 1918 that people who suffered from Spanish flu had as well. And it was all temporary as well.
Mm-hmm.
So those would be the symptoms. Now, the one you've probably been hearing about lately is called PMIS, Pediatric Multisystem Inflammatory Syndrome. And I liken it to what you hear about adults is they get COVID, they start coughing, they get short of breath, and on day 7 or 8, they seem to be getting better, and then on day 10, they go down. They have troubles breathing, they get sicker and sicker and sicker, and they end up in the hospital, and some end up on ventilators, some don't. Well, kids don't get that. They don't end up on ventilators from this. Very, very rarely, unless they have some risk factors that would point to really heavily obese, maybe some underlying lung disease, not mild or intermittent asthma. It's got to be moderate or severe, would be some concerns of getting this. So only 0.1% of kids who get the disease, remember that, not 0.1% of kids, but only 0.1% of kids who get COVID get really sick. Okay? So remember that the odds are way on your side, your kids are going to be safe. The balance to that is just because your kid's well, be socially responsible, because they're the ones that are going to affect grandparents. Teenagers are going to be impulsive about this sometimes and not remember to do this, and that's the obligation why you have to enforce the rules with your kids as well with this. So then there's the pediatric inflammatory disease. Basically, that's the same kind of issue where the immune system over-revs, and it actually ends up inflaming arteries throughout your body in children. And a small number of kids, and it's coming into Boston because I was talking to an expert today about it. And, New York had 76 kids with it. And what it is persistent high fever, prolonged high fever. Kids may have red eyes as well, may have a sore throat. They may get a rash or may not. And the interesting thing about kids like this is when your blood vessels are inflamed, one area is your hands, the palms of your hands and the soles of your feet look fiery red. And if your kid starts with a fever, and it ain't subtle, excuse the expression, and they've got fiery red palms, you need to bring them in. And then we need to see them. And the other symptom that kids have is a very fast pulse, because some of them, their blood pressure drops because the heart is weakened temporarily. But this is all very, very treatable. And the earlier you catch it, the better it is. Kids get aspirin, IV gamma globulin with this. And also, let me look, there was one other thing that I found with it, because I talked to the specialist today. And that's it, IV gamma globulin and aspirin especially. They may do some biologics, but that are used for arthritis and stuff like that, but they're not using it consistently now. So that's, and I suspect Children's has probably had 2 to 4 cases, which for an institution like that is still a pretty tiny number.
Yeah. So with that low, number of all the severe cases, a lot of these cases are, symptoms are not as obvious. They're symptoms that you see with a lot of other things right now. I can tell you from my experience, we're in peak allergy season right now, at least for me. What advice do you have for parents, where there are other things out there? Just because COVID's going on right now doesn't mean there aren't other illnesses and other things that might cause similar symptoms.
So with common colds or allergies, and if your kid has recurrent allergies every year, your child, then you know that this time of year, if they're sneezing, watery, itchy eyes, because interestingly enough, COVID eyes are not itchy generally. They'll be red, but not itchy. And remember, it's still basically fever, cough, shortness of breath. And you don't have fever with allergies, and most colds you don't have fever with. So keep that in mind. And allergies is going to have sneezing with it. It's going to respond to an antihistamine, itchy eyes, itchy nose. It's going to respond to antihistamines better, and much of the symptoms will settle down. Colds, you'll just continue with the runny nose, and you probably should not have any fever and no shortness of breath with a regular cold. Right.
Sorry, I'm getting a little feedback here. So, I think that's what we wanted to touch on in terms of symptoms and testing. But I think another important thing that we need to talk about is treatment. You touched on it a little bit with the multi-system thing that you were talking about. But what can you tell us about treatment in general for the kids that might not have as severe of a case of this?
Yeah, and if you want to go into, we can briefly talk about vaccines with that as part of the treatment, just quickly.
Yeah, that's perfect, because I had some questions about vaccines from some of the parents too.
So the treatment is really, there's no treatment in the sense of symptomatic treatment, runny noses, coughs, antipyretics like particularly Tylenol. There's been a controversy of ibuprofens being used in COVID, which really doesn't have any evidence yet, but people are concerned about using ibuprofen with this. So there's not much more you can do than that, and monitor your kids' symptoms and, see what they evolve over a week. And that's pretty much it. Did I answer that for you, Joe?
Yeah. I mean, let's touch on vaccines quickly, though.
Yeah.
We did have some questions. Two parents had asked almost the same question, word for word. The first part was, if it was to come out in the near future, a COVID vaccine. This is more of a speculation question, which we're trying to stay away from, but do we think it'd be readily available and safe to administer to infants and toddlers?
No, not yet. Infants and toddlers are going to be the last to get this vaccine because they are by no means high risk. An elderly person has 1 in 5 of a chance of dying from this, and a child, when they have COVID, and a child has less than 1 in 100. So you're going to be giving this to the elderly to start, and that's going to be people probably 50 and older, I guess. We're in Boston, where they're designing a vaccine. It's called an mRNA vaccine by Moderna. And this is ones that they're trying on healthy subjects. But remember, they've gone through phase 1 right now. That's a total of 8 patients. So they have to go through phase 2 and have a lot more patients. Then phase 3, they're going to have high-risk patients with that. And phase 4, people who get vaccinated are going to have to be exposed to people who have COVID, and see if the person mounts an immune response that's good enough to be protective. Again, we don't know that number. So kids are not going to get this right away. And the other problem is the capacity to produce. I hope there are, last count, 94 vaccines around the world being done. I hope 80 of them work well, so that everybody, because no single factory has the capacity to put out billions of vaccines. So we need a lot of different companies who are going to be winners in this case, as Dr. Fauci called it, so that we can protect the elderly to start. We don't know how long the vaccine will last. Some people say lifetime, some people say for a year or two, so it's going to be kind of like a flu shot. Well, but I definitely think that expectations for kids, it's going to be a long time before it gets down to kids and infants. Because
so in the meantime, obviously people are used to social distancing and wearing masks at this point. But we did have a question. Let's see, it was from Christina, mother in the practice.
One other Joe, one other thing. Let me just say.
Yeah.
Vaccine may go. I mean, it's obviously going to be done in nursing homes. as half the
Yeah.
cases in Massachusetts are from nursing homes. It's going to
Right.
go to meat packing plants, and it's going to be for hospital personnel, because these are the
Right.
greatest risk groups of all. I'm sorry, Joe, go ahead.
Oh, no, that's fine. That's fine. Christina, a mom in the practice, wanted to know, is there any sort of supplement we can use to boost our immune systems in the meantime?
Okay. The concept of boosting an immune system that may have millions of different pathways has always concerned me, because to validly understand this takes a lot of expertise, of which I have, particularly things about drugs that you're hearing about, Humira, Remicade, and all these drugs. These are the real biologic immune drugs, and you really got to understand what you're doing. I'm very concerned with giving kids supplements that would boost their immune system, because if they really do, somebody who gets COVID, remember, that second stage, I worry about them getting that pediatric multi-system inflammatory syndrome if we've revved their immune system by adding a supplement. Good, healthy exercise, healthy eating, and good sleeps are the big
Right.
issues that will help your child, not supplements. So you may be taking a risk, and if your kid gets COVID, their arteries may get attacked, or as an adult, your lungs may get attacked. So
Yeah.
I would not use any of these products.
Yeah, I think you hit the nail on the head. I mean, sleep, good appetite, and some outdoor exercise is never going to do you any harm.
Well, you reminded me of that. Thank you.
Yeah, just wear a helmet if you're on your bike. That's it. And I think we actually have some questions pertaining to bikes specifically, which we will get into very, very shortly. But I think before we open it up for some of the more specific questions, Dr. Hartman, you wanted to give some good news. Is that correct?
Yeah, I just think that I don't know if people have watched John Krasinski. He's done SGN, some good news. Go online. I sent out emails on this, and a fair number of people looked at him. But this is really cool to watch with your kids. His kids, made the signs for it, and he's gotten all sorts of people say what good things people are doing. Like in our practice, some person dropped off 80 masks to us, I believe. Wasn't that correct, Joe? Something like that?
Yeah. Multiple people have dropped off masks and other things that they made. It's been incredible.
And helping your neighbors, elderly people that may be helped, keeping your social distance, but just checking in on them is so important. And I think also what I've loved is to hear, now people may be getting tired of this right now, but people hearing that they're having family meals again. We're not running out, going to sporting events on a Saturday for the kids or on Sunday. We're actually sitting and saying how your day is. My 29-year-old daughter's here. She's in graduate school. And we meet lunch, and because I'm doing a lot of things by telehealth, and we eat dinner together, and sometimes breakfast. And it's really been nice to do that. Now, like I said, after a while, it might get a little bit old. And the one thing that we saw in the initial surveys about teenagers, and we figured they'd be anxious and more depressed. In the beginning of all this, they weren't. And I really wonder if some of this is the load of sports and school we put on top of kids, and they're much more relaxed because they don't have that kind of push by us parents. And as a result, though, I think it's key that they still need school while this is happening. But I also am watching now, because we are seeing, I think, more anxiety and depression as a secondary thing, because isolation is creating people. Thank God for Facebook. And I actually have enjoyed doing, especially with the teenage males that I see a lot of, doing these visits, because I just get a big kick. The kid doesn't get up. The mother goes to the kid's room, rustles him out of bed, and has him sit in front of the camera. And some of them are like, But then I had a guy.
11 o'clock in the morning, right?
Right. I got a guy who's brushing his hair, his golden locks, as I was talking to him.
Yeah.
And the other thing that's a miracle, I think, is working with kids on this autism spectrum. The problem with kids is sometimes, especially nonverbal kids, they run around a lot, and they're always trying to get in everything, and there's always parents trying to keep everything safe, and not destroy a room. The beauty is, I had one family, I talked for 20 to 30 minutes eye to eye with both parents when they were at home, and all you saw was the kid running back and forth behind them. But everything was safe there. They didn't have to look like they have to when they come to the office, or how their child's going to interact with somebody else. So that was a miracle to me with it, because that we can get from telehealth.
Yeah.
Okay.
Yeah, it's been incredible seeing telehealth roll out and how successful it's been, and it is cool to kind of do a visit in someone's home and see what it's like there.
So Joe, tell me what your guinea pigs behind you's names are.
Yeah, yeah, I got my guinea pigs behind me right here, little Phyllis and Scooter, and we actually welcomed a puppy home too, Hugo. He is downstairs, otherwise he would be all over me right now.
And here,
I think you have a little friend there too, don't you?
I have a little buddy with me here right now. He always sits in the study with me. He talk about my faithful dog. He desperately needs grooming, but his name is Buttons. Buttons is 11-and-a-half-year-old and a devil, but he's fantastic. So he's my buddy that's been with me the whole time. So.
Well, if Buttons wants to stay, I think it's time for some questions here. I think before we get into some of the specific questions, we just want to touch on what a majority of the questions were, which was daycare, visiting grandparents, let's see, your children hanging out with other people's children, and just all the social distancing stuff that is kind of starting to change, and basically what our recommendations are. Now, I want to say from the start, we can't really speculate in terms of daycare, if time frames are appropriate or if there should be more guidance from the state. We can't really step on any toes because we're really not the ones to make those decisions. However, I think it is our job to give you the frameworks to make good decisions with your family and at home. And one of the other partners, Dr. Strauss, has spent a lot of time over the past week outlining some of these frameworks, and it went out in an email today. So Dr. Hartman, do you want to cover just quickly kind of the guidance for some of the family decisions, and then some of the daycare and camp and all those decisions?
Absolutely. And I really urge you that Dr. Strauss is a fantastic writer, and he did a fantastic job really thinking this through, where asking yourself 4 basic questions to develop your framework. What is the risk? Is there anything, and this is in there already, so look online to see it. Is there anything that can be done to lessen the risk? What is the perceived benefit? And is the activity socially responsible? Does the activity put other people at unacceptable risks? Mm-hmm. And the topics he covers here are: you don't want to get sick with COVID, wearing a mask, maintaining social distance, and the basic things that you already know. But then topics that are in here, which I'm not really going to go into in too much detail unless Joe wants me to go in more detail: visiting with grandparents, visiting friends or neighbors. And you might want to look up the term quarantine, TEAM, at the end, because that was a really cool option a couple of families could have together, isolating as almost one family.
Yeah, and let's stop there just for 1 second, because we had 2 questions come in, and Julianne, I think, just asked a question as well about this. It got cut off a little. We're getting so many questions; they're scrolling by a little, but basically, there's some people that have maybe out-of-state relatives and with no underlying health conditions. They've been dying to see their children, come spend the night. The email does give some guidance into that, but at the end of the day, if those, if your parents have been as safe as you've been and have been quarantining and haven't been going anywhere and kind of are assuming the same risk level that you've been taking, that's an opportunity to make a quarantine where they may become part of your inner circle. And the important part to focus on if you choose to do something like that is that any risk that they take becomes a risk that you take. So if there's someone in your inner circle that, maybe is going out to, shop at some grocery stores frivolously when they don't have to, that's a decision and that's a risk that now is going to affect everyone in that circle. Dr. Hartman, do you have anything else to add on that?
I think the likeliest group will be your teenager. So if you're going to do a quarantine with grandparents, you really got to make it clear, and they have to be isolated for 2 weeks within the state, technically, before you can do this. And, you expect to stay together for a month, with that, if you can, because that would be the only way that would fully work. And, grandparents, maybe what I'll touch on with that is, and by the way, when you look at travel out of state, it's very variable depending on the state, how long you have to quarantine while you're there. So keep that in mind.
And I'll touch on that real quick too. The reason that there is some out-of-state differences and why Massachusetts is so different than other states in terms of coming into the state and then quarantining is that so many states around us are loosening restrictions at different levels than we are and at a different pace than we are. So you might go to Maine or New Hampshire or somewhere else where their guidance and their protocols are different than ours. So doing the same activities that you do here in those states may actually put you at a higher risk than if you were to do them here. So that's why they kind of recommend the quarantine when you come back. Sorry, Dr. Hartman.
That's all right. And just check, because I believe Maine had some huge fines for people who don't comply with what they say. And I know that going from Rhode Island to Connecticut, I believe it was, there's state police on the highways looking for your license plates and will stop you if you're from an out-of-state license. So anyway, so I guess the big question about visiting grandparents visiting is really in good detail here. And it's a little bit more flexible than what you see in the Macy and the CDC guidelines, but it's a reasonable thought process, very reasonable thought process that Dr. Strauss went through. But I think it's absolutely very important that, the teens and young adults, these are the ones that are sensation seeking and impulsive. That's why you can't rent a car till you're 25, because your frontal lobe isn't fully developed yet. So that's, I think, very important. If you can trust your teenager, fine. But I would have a lower threshold for trusting a teenager than I probably would for a 9-year-old. And remember, with swimming, you have to ask yourself, in swimming, how many kids ever socially distanced before this? No, kids bump into each other, they're screaming and yelling, and COVID's not going to be transmitted by water. It's going to be transmitted into the eye, the mouth, the nose, as kids scream at each other if they get too close to each other. So keep in mind, that's the biggest problem. And also congregating on the decks, okay? This is a CDC guideline on pools. It's really good. Just have to put it in. These are the guidelines here on camps. So you might want to look at these checklists, and any camp you're thinking about going to, which is very different, like a day camp with computers versus an overnight camp. And there's a big difference. And then school programs as well. So these are all on the CDC website, in addition to what we wrote, which is a little more refined. And I think this would be very helpful in you assessing your level of tolerance of risk to make your decision.
Exactly. And I think just one additional thing to talk about is knowing the difference between a high-risk activity and a low-risk activity, and how sometimes the difference between a high-risk activity and a low-risk activity is how you handle yourself doing those activities. Like there's a way to make many things safe. It's just how you choose to conduct yourself, and sometimes how your teenager chooses to conduct themselves. We got questions specifically about riding a bike, and it's like, yes, that's a low-risk activity, but it can quickly become a high-risk activity if they're inches away on a sidewalk together, not wearing a mask in, literally next to each other. That's a high risk activity. If they're out on a trail or on your street and they're totally separate and they're not going to come near each other and they're wearing a mask, now it's a low risk activity. So if you were to just say bicycle riding in general, it's tough to give you an answer. It's really how you do it, not what you're doing. And that is pretty much across the board for all of this. I mean,
Absolutely.
like you said, Dr. Hartman, you're not going to catch COVID from swimming in a pool. You're going to catch COVID by how you're swimming in the pool and maybe who else is swimming in the pool around you.
And
that's what's going to be the dangerous part.
And kids like to ride bikes side by side with each other. And what I say to you, if you allow your child to ride on the street, then one rides on the sidewalk and the other one rides in the street and stays 6 feet away from each other.
Mm-hmm.
I think that would make it so you don't have two kids in the road trying to stay 6 feet apart.
Yeah.
You know?
And I think to mention what Dr. Strauss was talking about just when we were talking to him a couple of days ago is you have to also weigh the benefits. And if you have to socially distance in a pool 6 feet apart, then what's the point of being in the pool? It doesn't seem much fun if you're just sitting there and standing in place while someone's on the other side of the pool. There's really no benefit at that point unless you just want to take a quick dip and cool off. I think we covered that in pretty good detail. Again, reference the email. It covers everything we just talked about. And I think we just sent out some of the guidelines through the chat regarding pools. And, there's all that other information on the CDC website as well. But a couple more specific questions that came in. One of these is specifically about juvenile rheumatoid arthritis. The child is on Humira. How worried should that parent be about the virus? I know you had an opportunity to reach out to a specialist about this, Dr. Hartman, and
I talked to a pediatric rheumatologist specialist at Children's, and this is the advice she gave me. Thus far, we're not advising our patients to change their medications unless they are actually sick. All the data that we have heard about from both adults and children from China and Italy, which are where the heaviest hit until we are, have not suggested that our patients on these medications are at any significantly increased risk, somewhat contrary to what was expected. The risk factors for severe COVID infection still appear to be within the African American community, which I think more has to do with the inability to social distance as easy and poverty cramming a lot more people in. Not every African Americans impoverished, but in the inner cities, it can be pretty tight. Obesity, high blood pressure, and underlying lung disease. Asthma does not seem to be significant risk factor unless it's moderate or severe, which is only about 10% of asthmatics in general. And in fact, we may find out that some of these biologics, like Humira, may or may not, they're looking at it right now, help deal with the secondary inflammatory effect that will attack the lungs and arteries, and lungs in adults, arteries in kids, and it may actually reduce the storm, we call it the COVID storm, that happens with all those inflammatory chemicals pouring out into the body by kids and parents and grandparents. That answer that, Joe?
I think so. Thank you. Quick question. It came in through the chat. Any thoughts on toddlers versus infants in terms of daycare? I know we can't speculate on any sort of protocols or anything like that, but I think the question is really just in regards to the dangers of COVID probably between those two age groups.
Well,
any input on that?
Well, I guess it's kind of hard to say. And again, that goes back to asking questions about what the daycare is going to do and what their thoughts, the DPH's guidelines are going to be, the Department of Public Health here in Massachusetts. But what I could say is this: when you're not that mobile, it'll be easier to control. So when kids hit somewhere around 8 to 11 months, they're suddenly mobile. And toddlers who wander around do share binkies sometimes, do slobber over each other. So, yes, I think it's going to be very difficult for daycares to deal with not having social distancing, not being able to wear masks, disinfecting constantly. And
Hmm.
I'll be curious to see, frankly, what they put out for the daycare centers and things
Yeah.
like that.
Yeah.
School kids, again, we don't know if kids are going to go, and you're going to have to watch Charlie Baker. Is every Monday night, every Monday noontime or 11 o'clock speech gives everything, and the press conference is online that you can read. I mean, schools are going to have different things if they do open. They're going to have staggered schedules. This teacher is going to move in the middle school and high school, not the kids.
Hmm.
Maybe some kids will go a half day and maybe other kids will go another half day. What I've heard is also people doing hybrids of a mix of online learning and then in class learning. And I suspect that's to be able to have a small enough class to be able to have social distancing between the kids.
Yeah.
So
Yep.
those are some of the things that are going to come down the line, but that's about all we know right now.
Yeah. Yeah. Thank you. Thank you. One other question that we had, um, this mom said she really doesn't want to miss childhood vaccinations, but what if I get sick right before my scheduled well visit or come in contact with someone who is diagnosed with COVID? Can I still bring my child to the office?
So I think,
Um,
yeah, I think it's a great question, but if you're sick, I wouldn't come in, okay?
right.
Because if it's COVID, we don't want people coming in. And by the way, coming in means you're not going to sit in the waiting room. You're going to wait in your car. But even that we view as a little bit too much of a risk. You know,
Right. So from a policy standpoint, in terms of risk, obviously, we got rid of the waiting room. Seems like 3 months ago at this point. I think it was end of February, beginning of March.
yeah,
So, there's really no risk there if you were sick and came in, because again, you're going to wait in your car and then we're going to bring you straight into the exam room. But I think when we think about risk benefit, we just don't want to expose, staff, potentially other patients that you could come in contact with, whether it's briefly in the hall. It's just really not worth it. But with that said, we're treating everybody that comes into the office and that works in the office as if they have COVID. There's a lot of other hospitals and practices and clinics that are sticking by the DPH and CDC guidelines, which are great. We're going a little bit overboard and a little step above that, and we're actually pretending that everyone comes in already has it. So the PPE, or personal protective equipment, that we're wearing protects us and protects you so much that if you actually had COVID and didn't know it, you were asymptomatic or you just weren't symptomatic yet, there's actually no need for us to quarantine or for you to quarantine because we're taking that extra step. You'll probably see all of our nurses and providers wearing face goggles and gloves and gowns and masks. It's more than we have to, but we think it's our job to keep you as safe as possible. So if that was to happen, if you did come in and you were a little bit sick, we certainly don't want you to, but you wouldn't be putting us really in a dangerous situation. We just really don't want that to happen for the safety of our staff and
and,
safety of our patients.
and also, one of the concerns in emergency rooms is the people they see delayed
Mm-hmm.
coming in. We've had 3 kids with appendicitis as young as 5 the last few weeks that were diagnosed over telehealth and were sent and had their appendix removed. The ERs have been telling us that there are kids that the parents have waited too long and the appendix bursts, which can be life-threatening, or it's going to keep you in the hospital, maybe even 2 weeks
Mm-hmm.
as a result of that. So you don't want to delay if you think your kids are ill. And the phone is always there to access us, to talk to us. And then we can also do virtual visits for this. So you don't have to worry that if I bring them into the office, I'm going to get sick. In fact, in some ways, our office is probably a lot safer than a grocery store.
Yeah,
And so
definitely.
I would keep that in mind, that you need to be able to use your mindset that you would if there was not COVID about bringing your child in, especially if they're really sick and you're not clear on what's going on, you don't do a wait and see. You call us, please, and we'll help. We'll help.
Yeah. And the thing about that too, it's kind of funny. I mean, we're so over the top with a lot of these safety procedures and cleaning procedures. I don't think our office has ever been as clean and safe. You know, I mean, you think about flu season and how many people are in and out. The waiting room's always packed. It's not like that right now. You know, we're still seeing plenty of people, but we're just so over the top with how we're handling it. There shouldn't really be any concern.
And one thing, especially in pediatrics, you know, it's all different bacteria we're concerned about, but a reemergence of measles would be a disaster. Mm-hmm. Because measles is highly 4 times more infectious than COVID ever will be. You walk in a room 2 hours after somebody has been in that particular room, you could get measles. Mm-hmm. And measles can be deadly. And that's why we want to make sure all our kids get their shots, and the priority visits for well checkups were the ones that kids have to get vaccinated on. Then we'll reopen more and more to all kids as we feel comfortable seeing what the DPH guidelines are that are coming down the line, and hearing what Children's, which is actually developing we're part of Children's. They're developing the guidelines for camps and for daycare centers too. Right.
Perfect. So we have 2 more questions. I want to briefly discuss them, but not answer them. So we had 2 questions just about, you know, their children are feeling kind of down and anxious, exhausted after all their, you know, Zoom calls for school. Some parents are experiencing regressions during quarantine. They feel like they're kind of headed backwards in terms of behavior. And these are certainly important questions, but ironically enough, we're already planning WMPEDS-Live number 2, and our very own Dr. Cullinane was planning on doing the next episode literally about these questions.
She has 3 young kids, so she's going through it.
Yeah, exactly. So she's seeing it from every angle. She's seeing it as a mom, as a doctor, and just seeing every angle there is to see. So she wants to focus in this next WMPEDS-Live event about sleep changes, behavior regressions, and then also about how to prepare for separation anxiety when school and work and everything else starts to open up. So the plan right now is to do the next episode most likely next Thursday, probably around the same time, 7 or 8 o'clock. You know, once you put your kids to bed or get some time to listen in. And that's what we can look forward to for next time. Again, we're probably going to send out another form like we did this time, so you can send some questions in ahead of time. And let's try and focus on these topics for next week's discussion. Obviously, I assume we're still going to get a lot of daycare and camp questions still, but let's focus on some of the separation anxiety and sleep changes and behavior.
And I think if people have time to read the press release the governor puts out every Monday, or at 11:30, look at the updates. They go through all the updates on the latest that they know about guidelines. We don't know yet about when schools are going to open, or if they're going to open, or when they're going to open. But you will see that through the governor's decision making.
Right. And I also want to mention real quick, I mean, if you have any questions specifically pertaining to your child, obviously give us a call, you know, send us a MyChart message. This isn't the forum for specific or acute health advice. This is more of a broad questions about, you know, whatever topic we're gonna host. But I think that about wraps it up. Any final comments, Dr. Hartman? This has been great.
And I tell parents, trust your gut. You know the child better than any of us do. Mm-hmm. I mean, I may be the expert of pediatrics, but I'm not the expert of your child. So together we work as a team to do what's best for your child. And that's the attitude all of us have at Westwood Mansfield Pediatrics. And thank you for joining us. I really appreciate it. Be safe and have a good evening.
All right. Thank you. We'll see you next week. All right. Take care.